The field of nanomedicine has rapidly evolved in recent years, showing great promise in tackling various healthcare challenges. Among the areas where nanotechnology holds significant potential is the treatment of autoimmune skin diseases. In this comprehensive script, we will explore the various aspects of medical nanotechnology in addressing these conditions. We will delve into the mechanisms of autoimmune skin diseases, the use of nanocarriers for drug delivery, nanosensors for diagnosis and monitoring, nanoparticles for topical delivery, nanoscale imaging techniques, nanotechnology-based gene therapy, Nano Theranostics, nanoscale biomaterials for wound healing, immunomodulatory nanoparticles, nanotechnology and phototherapy, and safety considerations in nanomedicine. Through this script, we aim to provide medical students with in-depth knowledge and insights into the potential applications of nanotechnology in the management of autoimmune skin diseases. Autoimmune skin diseases encompass a wide range of conditions characterized by aberrant immune responses against the skin's own cells and tissues. These diseases, such as psoriasis, systemic lupus erythematosus, and bullous pemphigoid, can be chronic, debilitating, and have a significant impact on patients' quality of life. Traditional treatment approaches often have limited efficacy and may result in systemic side effects. This has led researchers to explore the potential of nanomedicine in offering targeted and personalized solutions for autoimmune skin diseases. Nanomedicine, the application of nanotechnology in medicine, offers unique advantages in the treatment of autoimmune skin diseases. By utilizing nanoscale materials and structures, it is possible to precisely control the delivery of therapeutic agents to the affected areas of the skin, minimize systemic exposure, and enhance therapeutic efficacy. Additionally, nanosystems can be designed to overcome barriers, such as the stratum corneum, to facilitate the penetration of drugs into the skin. The integration of nanotechnology in medicine opens up new possibilities for the management of these complex skin conditions. To fully comprehend the potential applications of nanomedicine in treating autoimmune skin diseases, it is crucial to understand the underlying mechanisms contributing to their development and progression. These diseases involve dysregulated immune responses, including the activation of T cells, B cells, and various cytokines. The interaction between genetic and environmental factors further complicates the pathogenesis of autoimmune skin diseases. In psoriasis, for example, activated T cells play a central role in driving inflammation and epidermal hyperproliferation. This leads to the formation of characteristic plaques and scales on the skin surface. Similarly, bullous pemphigoid involves autoantibodies targeting specific proteins in the basement membrane zone, resulting in blister formation. By understanding these mechanisms, researchers can identify potential targets for nanotherapeutic interventions. One of the key challenges in treating autoimmune skin diseases is delivering therapeutic agents in a controlled and targeted manner. Conventional drug formulations may have limited efficacy due to poor skin penetration or systemic side effects. Nanotechnology provides an innovative solution by enabling the encapsulation of drugs within nanocarriers, such as liposomes, polymeric nanoparticles, or dendrimers. Nanocarriers offer several advantages in drug delivery. Their small size allows for increased skin penetration, while surface modifications can enhance the specificity of drug targeting to affected skin regions. Furthermore, nanocarriers can protect drugs from degradation, prolong their release, and improve bioavailability. By selecting appropriate nanocarriers and optimizing their characteristics, it is possible to achieve localized and sustained release of therapeutic agents, minimizing systemic exposure and side effects. Accurate diagnosis and monitoring of autoimmune skin diseases are vital for effective treatment. Nanotechnology-based sensors offer novel approaches for disease detection and real-time monitoring. These nanosensors can detect specific disease-related biomarkers, enabling early intervention and personalized treatment. Nanosensors can be designed to detect biomarkers present in the skin, blood, or other bodily fluids. For instance, quantum dots can be functionalized with antibodies to recognize specific autoantigens associated with autoimmune skin diseases. By utilizing fluorescence-based readouts, nanosensors provide rapid and sensitive detection, enabling clinicians to assess disease severity in response to therapy. The development of nanoparticles for topical delivery represents a promising nanomedicine approach in the treatment of autoimmune skin diseases. These nanoparticles are designed to penetrate the stratum corneum, the outermost layer of the skin, and release therapeutic agents in a controlled manner. Nanoparticles can be engineered from biocompatible and biodegradable materials, allowing for safe administration. For instance, solid lipid nanoparticles have demonstrated efficient delivery of drugs such as corticosteroids and immunomodulators to the targeted skin layers. Additionally, stimuli-responsive nanoparticles release drugs upon exposure to specific triggers, such as pH or temperature changes, providing spatiotemporal control over drug release. Accurate imaging techniques are essential for diagnosing and monitoring autoimmune skin diseases. Nanotechnology has contributed to the development of advanced imaging modalities with enhanced spatial resolution and contrast for precise characterization of disease manifestations. Nanoscale imaging techniques, such as atomic force microscopy and scanning electron microscopy, allow visualization of skin structures and features at the nanometer scale. These techniques enable the detection of subtle changes in cellular morphology, matrix organization, or immune cell infiltration, providing valuable insights into disease progression and response to therapy. Nanoparticles can also be used as contrast agents in imaging modalities like magnetic resonance imaging, MRI, or optical imaging, improving the sensitivity and specificity of disease detection. Gene therapy offers a promising approach for the treatment of autoimmune skin diseases by targeting specific molecular pathways involved in disease pathogenesis. Nanotechnology-based delivery systems facilitate the efficient delivery of therapeutic genes, enabling precise modulation of immune responses in the skin. Nanoparticles can protect therapeutic genes from degradation and enhance their stability. Additionally, surface modifications can promote specific interactions with target cells, achieving high transfection efficiency. By delivering genes encoding anti-inflammatory agents, immunosuppressants, or regulatory proteins, nanocarriers can help modulate immune responses and restore immune balance in autoimmune skin diseases. Nano Theranostics combines therapeutic and diagnostic functionalities into a single platform, enabling simultaneous diagnosis and treatment. In autoimmune skin diseases, Nano Theranostics can provide personalized interventions by integrating disease detection with targeted therapy. Nanoparticles can be engineered to carry both therapeutic agents and imaging probes. By employing the imaging probes, clinicians can accurately assess disease severity and response to therapy without requiring separate imaging procedures. Furthermore, these nanotheranostics systems can yield real-time feedback on drug release and biodistribution, aiding in treatment monitoring and optimization. Wound healing is a critical aspect of managing autoimmune skin diseases, as chronic inflammation often leads to tissue damage and non-healing ulcers. Nanoscale biomaterials offer unique properties for promoting wound healing, such as enhanced cellular adhesion, controlled drug release, and modulation of the wound microenvironment. Nanofibrous scaffolds, for instance, can mimic the structural architecture of the extracellular matrix and provide a suitable environment for cell attachment and proliferation. By loading these scaffolds with growth factors or antimicrobial agents, it is possible to promote tissue regeneration and prevent infections. Nanomaterial-based dressings with controlled drug release capabilities can provide sustained wound healing support and facilitate the recovery process. The dysregulated immune responses observed in autoimmune skin diseases highlight the need for targeted immunomodulatory interventions. Immunomodulatory nanoparticles offer a versatile approach to regulate immune cell activity and restore immune homeostasis. Nanoparticles can be designed to interact with specific immune cells, such as dendritic cells or T cells, to induce immunosuppression or modulate immune response. By leveraging surface modifications, nanoparticles can selectively deliver immunosuppressive drugs, antigen-presenting molecules, or gene-based immunomodulators to target cells or tissues. These nanoparticles help restore immune balance and alleviate autoimmune skin disease symptoms. Phototherapy, the use of light for therapeutic purposes, has been widely employed in the management of autoimmune skin diseases. Nanotechnology has revolutionized phototherapy by enhancing the efficacy and specificity of light-based treatments. Nanoparticles can act as carriers for photosensitizing agents, making targeted phototherapy possible. For example, encapsulating photosensitizers within nanoparticles allows for controlled release and increased accumulation at diseased skin sites, minimizing damage to healthy tissues. The combination of nanotechnology and light-based treatments offers new treatment options with improved outcomes and reduced side effects. As with any medical intervention, safety and toxicity considerations are essential when utilizing nanomedicine for the treatment of autoimmune skin diseases. The unique properties of nanomaterials may raise concerns regarding their potential adverse effects on human health. Careful characterization and evaluation of nanomaterials' physicochemical properties are crucial to assess their potential toxicity. Researchers must consider factors such as particle size, surface charge, stability, and biodegradability. Furthermore, the choice of biocompatible materials and appropriate dosing regimens are crucial to ensure the safe and effective use of nanomedicine in clinical practice. Extensive preclinical and clinical studies are undertaken to assess the safety profiles of nanosystems, enabling better risk assessment and the development of safe nanotherapeutic approaches. In conclusion, nanomedicine holds significant promise in revolutionizing the treatment of autoimmune skin diseases. The use of nanocarriers in drug delivery, nanosensors for diagnosis and monitoring, nanoparticles for topical delivery, nanoscale imaging techniques, nanotechnology-based gene therapy, Nano Theranostics, nanoscale biomaterials for wound healing, immunomodulatory nanoparticles, nanotechnology and phototherapy, and the consideration of safety and toxicity are just a few examples of the multitude of approaches being explored. By harnessing the unique properties of nanomaterials, researchers and clinicians can enhance therapeutic efficacy, minimize side effects, and improve patient outcomes in the management of these complex dermatological conditions. It is imperative for medical students to be familiar with these advancements in medical nanotechnology to contribute to the future of autoimmune dermatological care.